Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to talk about Lyme disease. I apologize for being a little bit late here tonight. I've had one of those days that is just stretched on and on in terms of helping people here in my office. So I apologize for that, but we'll be with you here for about an hour and a half tonight answering your questions. For those of you that are returning, it's good to see some familiar names here tonight, and I'm glad to see that you keep getting some value by that. I see that there are a number of new people here tonight too, so to those of you that are new here, welcome. There's a couple ways you can participate in the webinar tonight. One is to listen to the questions as I read them, and if you're in the live version of the webinar, you can actually see them on your screen. They show up in the live version on your screen, so you can read that and follow that along too. The second, and then see what responses I give, because usually as part of my responses, I explain a lot of things. I think some of you know I can get somewhat long-winded, but always for a good reason. The second way you can participate is to write a question to me. And the way you do that is there is a chat box at the bottom of your screen on the right-hand side. And you can go ahead and write your question there. As you're writing that question, I ask that you do not hit the enter key until the whole question is written. So write it as one big run-on paragraph. Don't try to break it into multiple paragraphs. Just write it as one long thing, okay? The problem is if you try to hit enter key multiple times to break it into paragraphs, that sends separate questions to me, and it gets to be really hard for me to follow from my side, okay? I am creating a recording of tonight's webinar, and tomorrow morning, you'll get an email from me saying when that's ready. My goal is to have it ready by 9 to 9:30 a.m. Pacific Standard Time. We'll see how that comes together. Sometimes there's some glitches I run into, but that is my goal. You'll see that when you get that notice of that email, it has a synopsis of what we talked about tonight. And also there'll be a form you can use to sign up for the next webinar. So the next webinar was supposed to be, and you hear the word supposed to be next Wednesday, but I'm going to reschedule it to the week after. I've had some things that have come up that I'm going to have to deal with next Wednesday, and I'm not going to be free to do it. So we're going to move it out to the last Wednesday in February instead of being the 3rd February. So, but in the sign up for tomorrow, there'll be in that email tomorrow, there'll be a sign up, a link to sign up for the next webinar, which will be in 2 weeks. Okay. All right. And so tonight, it looks like we have the largest crowd I've ever had in one of our webinars. So we've had literally hundreds of people sign up tonight. And that's great. I'm glad that they're all here. Be aware with this number, many people attending, I will not be able to get through all the questions tonight. I'll do as great of a job as I can. So if your question gets missed, I'm not purposely trying to avoid you or anything like that. It just means we had a lot of questions tonight. Okay. All right. But I'll do my best job. Okay. So without any further ado, let's go ahead and get started here. Hello, Dave. Let's see. Hi, Dr. Ross. I've heard in previous webinars that while treating, you allow your liver levels to become elevated up to 2 times the normal levels. Do you allow this as well when treating for mold toxicity using the herbal mycopole binder, or do you switch binders if liver becomes elevated? Thanks. So, first of all, when you're talking liver numbers, I want to be clear with everyone what we're talking about. So liver numbers, there's a couple of enzymes that we measure from the liver to determine if it's being inflamed by the work that we're doing. And those 2 enzymes are called AST and ALT. And I don't necessarily I like to have them in normal range if we can. So these labs, if you look on your lab form, you'll see they're reported. Each laboratory system has a different normal range, but they're usually somewhere between about 5 and 20 or 5 and 40, somewhere in that range. Okay. So that's the range. And what my goal is to keep the liver enzymes so they don't go above 2 times the upper end of normal. So if your lab says the normal range is 5 to 40, the upper end of normal is 40, and that means I would accept going up to 80. Okay. The reason you get concerned about liver inflammation is if it goes on for a long period of time, you can get scarring of the liver. That's called cirrhosis. Okay. But short periods of time and low levels, which is 2 times 2 times less than the upper end of normal, or the upper end, no more than 2 times the upper end of normal. That doesn't run you into trouble with getting into liver scarring or liver cirrhosis, okay? Where you most often see elevations of these liver enzymes is due to prescription antibiotics. Also, some of the medicines that we use to regulate pain, like gabapentin, the anti-seizure medicine, gabapentin, and some of the other anti-seizure medicines, sometimes can lead to elevation of the liver enzymes as well, too. And sometimes infections like we know hepatitis A, hepatitis B, hepatitis C can lead to liver elevation, but also Lyme sometimes can inflame the liver as well, too. At least that's been what my experience has been here. I have not seen the binder called mycopole lead to elevation of liver enzymes. All right. So what mycopole is it's and what a binder is. So those of you that are not familiar, there's about 25% of all people, whether they have Lyme or don't have Lyme, that have a problem removing mold toxins when you breathe them in. Okay. So if you go into a building that has mold behind the walls and the mold is off-gassing toxins, you breathe that in, that gets absorbed into your bloodstream. In 75% of us, what happens when we breathe in those mold toxins in our bloodstream is the immune system, some of the immune cells will see those mold toxins, they'll tag them, other immune cells will come in and break them down, and we never have a problem with mold toxins at all. In other words, we deal with it, okay? But there's 25% of people where the immune system is genetically programmed incorrectly, and it does not tag the mold toxins, and therefore those mold toxins don't get broken down. And then they get trapped in you. Part of the process of how the body still tries to deal with them is mold toxins are fat toxins. Fat-based toxins are supposed to be cleaned out by the liver or transformed by the liver. The liver is supposed to take a fat-based toxin, slap a water-soluble group on it, and then move it out into the intestines, where it would get mixed in our poop and we poop it out. However, with mold toxins, the liver isn't able to transform them. And so they go to the liver, fat soluble, they come out of the liver fat soluble, and they go out into the intestines, and out in the intestines, they get reabsorbed right back into the bloodstream. So you just get this endless loop of toxins. And the problem with that endless loop of toxins is they trigger an immune reaction where your immune system overproduces a group of chemicals called cytokines, okay? When you have Lyme, your immune system overproduces cytokines. So Lyme and the co-infections and mold toxicity all have a similar outcome. They all produce too many cytokines. And it's too many cytokines that give you the so-called mold toxin symptoms and the so-called Lyme symptoms. And so too many cytokines make it so you can't think, give you fatigue, interfere with how your hormonal systems work, make you hurt all over, disturb your sleep, etc. Okay, those are all excess cytokine symptoms. Okay, so what we do with people that have mold toxicity is we try to bind those toxins in the intestines, giving something that binds them. And mycopole is composed of a number of herbs that will bind up these toxins so that you can poop them out, basically. Okay, but so the mycopole stays in the intestines; it's not absorbed. So it should not do anything to elevate your liver enzymes, okay? So if you are on mycopole and seeing elevated liver enzymes, I would be inclined, if you were my patient, to want to look and see what else you're on that might be triggering those liver enzymes to go up, because it shouldn't be the mycopole, okay? All right. Thanks for that question, Dave. Hello, Tim. Hi, Dr. Ross. How are you? I'm doing well, thank you. See, for Bartonella treatment, is it okay to switch from fluconazole to itraconazole in the middle of treatment? I'm 2.5 months in, or will that make me start all over? Is one better than the other? Also, I was wondering what the itraconazole dose is for Bartonella. Thank you so much. Okay. So what Tim's talking about is there's a group of medicines we traditionally use to treat fungus and yeast infections, and they come from a family called the azoles, A-Z-O-L-E. They all end in it, okay? So fluconazole and itraconazole are typically medicines we use to treat yeast. About 4 or 5 years ago now, Johns Hopkins University conducted a study where they took a representative drug from most major anti-germ families, and they tried to see could that family have any activity against Bartonella. And specifically, they looked to see could it treat growing Bartonella, but could it also treat Bartonella that goes into hibernation, or we call that persister Bartonella, okay? And in their study, they showed that clotrimazole, which is something we use for vaginal yeast creams and skin yeast creams, that clotrimazole was actually quite effective against both growing and persister Bartonella. And so a number of my colleagues started using clotrimazole, but keep in mind it's not manufactured in oral form, and they were having it compounded. But boy, when I looked at the absorption data, even on that, I just didn't think it would ever get absorbed well enough, even if a compounding pharmacy made it. In a way, would that be meaningful? So I avoided using the azoles. And then around a year ago or so ago, I started thinking, wait a minute, why not look at the other members of that family, like fluconazole, like itraconazole? Let's see what happens. So that coincides. So I started doing it, and I started noticing a number of my other colleagues started doing it too. I don't know who did it first, but one of us did. And but I've noticed some good improvements using the azoles. And usually I'll start with fluconazole. It's cheaper, it's easier to get access to. But at times I will change to itraconazole, and I will do that in two situations. One of the reasons I'll switch to itraconazole is if I've got a person that I'm also trying to treat intestinal yeast, and the fluconazole is not working for the intestinal yeast, I want to change to itraconazole, because itraconazole may work better. Okay, that's one reason. The other reason I'll change from fluconazole to itraconazole is if I've got a patient we've had on the regimen involving fluconazole, and suddenly it looks like they're not advancing anymore on that fluconazole, I may change to itraconazole to see if we get better effectiveness with it, okay? When you switch from a fluconazole to an itraconazole-based regimen, you do not need to start over in terms of the timeline of how long it takes to get rid of Bartonella. So many of you may be familiar with the fact that Bartonella, on average, about 85% of the time, can be cured and wiped out with 4 to 6 months of treatment. And I don't advocate pulsing antibiotics where you start and stop your Bartonella antibiotics, because Bartonella replicates every 24 hours. And during that period you're off of the antibiotics, it can come back pretty quickly. All right. So I know some of my colleagues, some of the other physicians that treat Lyme, do pulse their Bartonella antibiotics, but I see so many times that fails. And I've seen times when people have gone to one of those practitioners who's pulsed their Bartonella antibiotics, only to see that they didn't get much better. They come to see me and I use them without pulsing and they get better. Okay. Now, I have an article on Bartonella called Kills Bartonella Brief Guide. And there's a variety of antibiotic options you have. One of those is what I call the fluconazole-based option, or the azole-based option. You don't use just fluconazole and itraconazole by themselves. You need to pair them with either doxycycline, minocycline, Bactrim, clarithromycin, or azithromycin, okay? In terms of the dose that you use itraconazole at, I dose it at 2 of the 100 milligram pills 1 time a day. If I'm using fluconazole, I'm going to dose it at 200 milligrams 1 time a day. The one reason I like fluconazole-based treatments is I find they do a pretty good job of clearing the brain fog, better than I do with rifampin-based treatments. So anyway, that's one of the reasons I tend to go with it too. Okay, all right. Let me just do a quick screen share here so I can show you the article. This is also an article on managing Bartonella that you'll find in my new book called Hacking Lyme Disease. And I'll probably show that to you later today too, but it's in both my online site and in my new book called Hacking Lyme Disease: An Action Guide to Wellness. Okay, all right. So let me do a screen share here. Okay, so this is Treat Lyme by Marty Ross MD. This is my site, my information site for treating Lyme disease. Regarding this Bartonella article I'm talking about, take a look here in my online guide. Click on the infection treatment plan section here, and then scroll down. and you'll find this Kills Bartonella, a brief guide here. Okay, all right. And what you'll notice about this is this is an up-to-date article. I just updated it in January. It is the same article that you'll find in my new book, which there's a pop-up telling you that you can buy my new book now. Okay. Anyhow, let me get rid of that. So if you go down to the bottom here, there's a section where I describe tier 1 Bartonella treatment approaches. And there's a section I call the fluconazole-based treatments, which use fluconazole, azithromycin, clarithromycin, minocycline, or doxycycline. And I usually also include cinnamon, clove, oregano capsules in these type of regimens as well, too. I do that to strengthen the treatment of the persister side of Bartonella. I also do it to remove biofilms that can cover Bartonella as well, too. Okay. And then there's another section called rifamycin-based treatments. These will be ones based on rifampin and rifabutin. And then there are macrolide tetracycline-based treatments. These would be things that would use like an azithromycin with a doxycycline, for instance. Okay, all right. And then finally, there's a section I call my methylene blue-based treatments. Okay. In this article, I did give you herbal options as well too, and I talk about the importance with your Bartonella treatments of being on something called lumbrokinase to break down Bartonella that mixes and combines itself with your blood clotting protein called fibrin. You can read it here though, okay? And then for those of you that are interested in my new book, you can tap on this tag link here. This describes what is in my new book. It also gives you a few purchasing options. You can even read the introduction here if you want. But you can take a look at, basically you can either buy it on Amazon as a paperback, you can do Kindle, or you can buy from me directly through my store. The reason you want to buy from me directly from my store versus Amazon is I pay your sales tax. And as long as you order other things, you get free shipping from me as well too. Okay. All right. So this article, my book has over nearly 40 different articles in it, and it describes key things you need to know to get better from treating Lyme. In addition, it outlines treatment plans for each of the major infections. I also review some key antibiotics like disulfiram and dapsone in the book. I review various alternative medicine treatments and why I think some of them are not the best ideas, but you can find that all in the book as well too. Okay. All right. All right. Thanks for that question, Tim. Hello, Duke. Hi, Dr. Ross. Do you know if Thorn Mariva 500 is just curcumin or is it turmeric? If it is just curcumin, would it be a good idea to also take turmeric supplement as well in order to get all the beneficial nutrients in turmeric besides just the curcumin? Thanks for all your great info. So you're welcome, by the way. So the reason I use curcumin, everyone, is the active component of turmeric. All right, so the Indian seasoning turmeric, part of it is called curcumin. It's a chemical called curcumin. And I use it because it's very good anti-inflammatory, especially at lowering cytokines. It gets inside white blood cells and limits the formation of those cytokines that I was talking about earlier. It's also a very good antioxidant. I find it more effective to use pure curcumin rather than doing turmeric. That's just been what my experience is, okay? So that's why I tend to use it that way, okay? All right. Thanks, Stu. Thanks for your question. By the way, Thorn has changed the name of their product called Mariva 500, which is their curcumin product. They now call it curcumin phytosome, okay? And we carry that at my supplement store as well, too, okay? Thanks for our question. Hello, Dave. Let's see. Is yeast overgrowth only an issue with us Lyme patients, or can it occur with regular healthy people that don't have Lyme but have been on antibiotics for a long period of time? Also, is it certain that if you've been on antibiotics for a long period of time, you have yeast overgrowth, or does it only affect some individuals? So Candida overgrowth, Candida albicans, or yeast overgrowth in the intestines is a common problem that can happen to people that don't have Lyme. Okay, so things that predispose you to having too many yeast in your intestines include being on antibiotics for any reason, for any length of time, actually. Being on birth control is a risk factor. Being on steroids for any reason. Being under stress is a possible risk factor. Smoking is a risk factor. There's a number of risk factors that can lead to too many yeast growing in the intestines. In fact, if somebody comes to see me, one of the first things I do as part of my treatment program, and you'll find this in the Ross Lyme support protocol as well too, is I always screen people to make sure they don't have too many yeast. And I use a screening questionnaire, and basically it looks at your risk factors, what symptoms you have, and you score it up. And if you score over 140, that there's a high probability you have too many yeast as part of your problem. And interestingly enough, there are some patients that I'll just treat yeast based on that alone. I won't even go after their Lyme or tick-borne infections, even if they have positive testing, even if they have a history of a tick bite. Sometimes I'll just go after their yeast alone. And doing that is enough to get a number of people 100% well without ever having to treat their Lyme with antibiotics or their co-infections with antibiotics, either herbal or prescription. So keep in mind when we do this Lyme testing, most of our Lyme testing is just seeing have you had an antibody reaction. The antibody reaction doesn't prove that your immune system didn't get it under control. It's possible you can have Lyme in you. You can even have an antibody reaction to it, a positive Lyme test showing you've had an antibody reaction, and your immune system may have dealt with it. And so there are times that I have patients that if I just treat their yeast, I never have to go after their Lyme because I think their immune system took care of the Lyme. It's just yeast with some of the yeast intestinal symptoms creating cytokines that make their overall syndrome look like a Lyme disease problem as well too. Okay, all right. So in terms of how you diagnose yeast, you could get my book. There's my book. Okay, so Hacking Lyme Disease, an Action Guide to Wellness. Okay, the last section, the last chapter in this book, chapter 39, is my yeast screening questionnaire. All right, so you could go through this questionnaire, and there's actually about 4 or 5 pages of it, and basically you just fill it out. Okay, and at the end, if you score above 140, that's an indication that you have too many yeast. Okay. The other option, if you want to get my book, would be to look online. And let me show you where you find that. So in terms of my information website, there's 2 places you could find it. You could look in my yeast section here, click on this, is it a yeast problem? And in here, I do have my yeast screening questionnaire. You can click it right there. Okay. The other place to get at it is to look at my Lyme treatment protocol and just scroll down here and you'll find part 10 is about treating yeast. Oh boy, I don't like that pop-up. I think I'm gonna have to make it so it doesn't pop up as much. Anyhow, if you scroll all the way down here, you've got this yeast screening questionnaire. You can go ahead and click there. Okay. All right. Thanks for the question, Dave. Good luck to you. Hello, Sunny. Hi, Dr. Ross. Thank you for all you do. You're welcome. Would it be a good idea to add tinidazole in this treatment for BART plus Lyme? And that treatment is fluconazole, doxycycline, cinnamon, clove, and oregano lumbrokinase. Am I missing something else? Thank you very much. So I don't think you get any added benefit in this regimen adding tinidazole. So let me tell you why. So when we're treating for Lyme, we recognize that the Lyme infection has different forms and different growth states, okay? So the different forms are Lyme has a spirochete. You've seen that before. It looks like a corkscrew, okay? Probably see pictures of that on the internet. Lyme also has a way that it moves inside of cells. We call that the L form. So it's an intracellular form. And it loses its covering when it goes inside, okay? And then Lyme also has a microscopic cyst form. Now, the cyst and the spirochete can either be growing or can be hibernating, or we call those hibernators persisters, okay? Intracellular Lyme, it's not clear from any of the data that we have whether they can be both growing and persisting. I just don't know. We don't know, okay? All right. So the reason you would use a tinidazole as part of a Lyme germ treatment is it picks up the cyst form of the Lyme germ, all right? So the tinidazole is an azole, which treats cyst. Fluconazole is an azole, which I already reviewed as a way you can use to treat Bartonella. But as an azole, it should pick up the cyst form of the Lyme germ too. So therefore, I don't see any advantage of using it here. The other thing about this regimen, if you use both tinidazole and fluconazole together, they both stand a chance of inflaming the liver. So you don't want to add too many of those chemicals into your treatment that might do that, okay? All right, so breaking apart the rest of this regimen, the fluconazole for Lyme would treat the cyst, the doxycycline would treat a spirochete Lyme and intracellular Lyme, the cinnamon clove and oregano would treat persister Lyme and Bartonella and growing Lyme and Bartonella, and then the lumbrokinase would break up fibrin nest and that hold Bartonella, and fibrin being a blood clotting protein that wraps around Bartonella, and then and also break down biofilm sugar slime layers that cover Lyme and Bartonella. And then in terms of Bartonella treatment, the fluconazole, doxycycline together is a good treatment for growing and persister, and the cinnamon clove oregano also picks up this persister too. So you got a good treatment without the tinidazole there, okay? All right. Thanks for that question, Sonny. Hello, Jackie. Hi, Dr. Marty. Last week, we covered the weed, seed, and feed approach for chronic recurring yeast infections. My question is whether you recommend treating oral candida with clotrimazole atrocious if already taking Ampho-B or voriconazole for intestinal yeast overgrowth. I'm also following the Mito diet, and I read that you were gaining weight on this plan. I'm barely making 1,200 to 1,400 calories per day. I'm not sure how sustainable it is for a good year or two after completing Ampho-B. Have you heard similar feedback and any suggestions? Okay, so what Jackie's talking about is last week I talked about for people that have difficulty getting over yeast or get a lot of recurrent yeast infections, that we need to work with what I call a weed, seed, and feed approach. Weeding means killing the yeast. Seeding means putting good probiotics in to compete with yeast for territory. And feeding means a couple things. One, being on soluble fiber. Soluble fiber is a good food source for the healthy bacteria so that they'll knock back the yeast, basically, okay? And then as part of feeding, you want to make sure that you want to avoid simple carbs in your diet. And one way to do that is a paleo-type diet, or which one is this Mito food plan that Jackie's talking about here. Paleo-type diets are going to emphasize protein and fat, and they're going to de-emphasize and limit your grains, beans, and legumes, okay? And pulling those out sometimes can help treat starved yeast in a sense too, okay? All right, so the amphotericin that I recommended in that when I talked last week and that you're on right now is useful when you take it in a pill form at getting at yeast in the intestines, okay? Because it stays in the intestines, probably the strongest, broadest spectrum yeast killer we have. The problem with it, though, is because it's not absorbed into your bloodstream at all, it doesn't work its way back to your mouth to treat oral yeast, okay? For oral yeast, if you are on an amphotericin B, I would use something like a clotrimazole troche that dissolves in your mouth to treat the oral yeast if you have it, okay? Alternatively, if you're not on amphotericin B, but rather for a strong yeast killer you could use voriconazole, although I tend to shy away from it because I've had people have just terrible Herxheimer reactions on that one. But voriconazole does get absorbed, does take care of yeast in your intestines, gets absorbed into the bloodstream and works its way back into your mouth by getting in the blood, which then leak up and around the mouth membranes, leaks back into your mouth and can get at yeast up in the mouth. So if you're on voriconazole, you don't need to be on a clotrimazole troche at the same time, okay? Now, the Mito food plan that I talk about, which limits your simple carbs, sometimes is difficult for people to maintain weight. The way you maintain weight on a paleo type diet or this Mito food plan is to increase the amount of fats that you have, okay? So I'll show you everyone where you can look at this Mito food plan. It has diet sheets. It tells you which ones are fats, which ones are not. Rarely, I have a person that can't even just get enough weight on by even adding more fat. And in which case, then you may need to start reintroducing some of the carbs, but try to limit them. The beans, legumes, and grains, okay? All right. So let me just do a quick screen share here. Okay, so first of all, I did create an article based on last week's discussion of weed, feed, and seed. And if you want to see that, take a look at the latest here. And here's the article. It's called How to Fix Recurring Treatment Resistant Intestinal Yeast Overgrowth. And in here, I review the idea of doing the plant-forward paleo diet and also of being on soluble fiber foods, okay? So soluble fiber foods can be things like avocados, soy nuts, oat bran, Brussels sprouts, sweet potato, asparagus, and broccoli is a way of doing that, okay? All right. You can also do a pectin powder, and I list that here. In terms of my diet that I recommend, it's this plant-forward paleo diet. It's this one right here. And in here, you're going to see a bunch of resources that I have, including sheets that tell you how to determine how much fat and sugar you have, and even describe foods that are made up of fat and foods that are part of sugar. But take a look here. You'll see a bunch of things you can click to see those, okay? All right. Let's see, where am I? Here we are. All right. So for those of you that are seeing tonight, I have a pop-up window that introduces you to my book, and I guess I need to change the settings on that. So if you keep going to my website, you keep getting bombed with this pop-up. I had intended it would only show one time per visit, not with each page that you go to. So anyhow, I have to fix that, and I'll figure out how to fix that sometime the next day or two. So if that keeps getting in your way, I apologize for that. I just wanted to make people aware of my book, though. Yeah, so anyhow, thanks for your question, Jackie. Hello, Kumar. Let's see, can you please speak about the role of the following meds in the treatment of tick-borne infections and also COVID? Hydroxychloroquine, azithromycin, NAC, and melatonin. What kind of melatonin is best? Is zinc citrate a better form of zinc than zinc picolinate, gluconate sulfate? How can I calculate the amount of elemental zinc in the zinc citrate from allergy research or zinc picolinate from Thorn? Thank you. All right. So Kumar, I may not be able to answer all this question. In terms of COVID, in the early days of COVID, we thought maybe there was some evidence that said hydroxychloroquine and azithromycin would help. I think that as we worked with those, we find they probably don't. Okay, so I don't think they serve a role in treating COVID. In terms of treating tick-borne infections, Azithromycin can be useful as part of a Bartonella treatment. It can also be useful as part of a Babesia treatment, and it can be useful as part of a Lyme treatment. For Lyme, it's useful at treating intracellular Lyme and spirochete Lyme that are growing. Hydroxychloroquine is a quinine derivative that was designed originally as an anti-malaria medicine. It's really not that good as a malaria medicine. We now use it, though, because it is useful at changing the acid balance inside of cells where intracellular Lyme can live, making it so azithromycin works better. Okay, so including hydroxychloroquine with azithromycin gets you better treatment, perhaps, for intracellular Lyme. And sometimes I'll add it if my azithromycin doesn't seem to be doing a good enough job. It is also a very useful anti-inflammatory, believe it or not, too. So that would be a reason to use it, too. In terms of NAC and treating Lyme and tick-borne infection, it supports your liver. It's a good antioxidant. And melatonin, I primarily am using just for sleep reasons. That's it. In terms of how to calculate the amount of elemental zinc in the zinc picolinate, I don't know. I'd have to look it up. Okay. And it might be that they even have it on the bottle. We can go look together here and see if it's on there. Okay. So everyone, this is my supplement store. And anyone can buy from the supplement store. So it's for my patients, but anyone can. Okay. All right. So I do carry a Thorn zinc picolinate product. And that's this here. And in terms of the zinc picolinate, let's look at the label here and see what they say. No, it doesn't tell me how much elemental. This is something I would have to look more into. I don't know how to do it. Okay. Yeah, I don't see it in any of the product description information I have either. All right. Thanks for your question, Kumar. Hello, Simone. Hi, Dr. Ross. What is the treatment for tick-borne relapsing fever? There isn't a lot of literature on this particular condition that my son has. He doesn't have fevers, though. We suspect he's had it for 5 years or more, and his neurologic symptoms. Does Alinea work for tick-borne relapsing fever? So generally, tick-borne relapsing fever, in terms of this treatment, is similar to what we do for the Lyme infection, so Borrelia, okay? So it would involve using things like tetracyclines, could use macrolides, and tend to emphasize those. That's what I tend to do with my patients, okay? All right. Good luck. Hello, John. Hello, Dr. Ross. Which Igenics test do you recommend to see if you have Lyme? They have numerous options and my GP doesn't know which one to order. Thank you. All right. So there's one test I would recommend. So Igenics confuses the picture, unfortunately. I love Igenics. I think Igenics is a good lab. I think they've developed some good tests, but I think they confuse you with all their options and their panels, and you don't need to do all their options in their panels. The most efficient way of seeing if you have Lyme is to get their test, which is called an immunoblot for both IgM and IgG, okay? So I will show you their order form in a minute so you can see that. And I do not advise people to get panels that look for Bartonella, Babesia, and test for Lyme in multiple different ways. It's just the immunoblot, okay? So the immunoblot is a technique that Igenics developed that looks to see if your immune system is making antibodies against 8 different kinds of Lyme germs. And that's what makes it a good test, okay? The standard Centers for Disease Control way of measuring antibodies, called a Western blot, only looks to see if you have antibodies against the original East Coast strain of Lyme. So that's why it's not as good. The other thing that Igenics does with their immunoblot method is they take proteins from these 8 different kinds of Lyme germs and they genetically modify them and grow them in bacteria in the lab. This genetically modified proteins have basically make it so that remove the possibility of having false positive tests from having virus antibodies that attach to the Lyme proteins on the test, okay? And the way they make it so that virus antibodies won't falsely attach to these Lyme proteins is they remove the pieces of the Lyme proteins that hold on to virus antibodies. All right, so you decrease your chances of getting a false positive test too, okay? So let me do a quick screen share here. All right, so let's just pull up an Igenics order form here. Okay, so this is what an Igenics order form looks like. This is the part where you fill out a bunch of stuff about you, okay? And then back here, they have a bunch of panels, all right? And I would avoid doing their panels. These panels incorporate a number of tests in one blood draw, but as you're gonna see, they all tend to be kind of expensive, okay? And what I would do is go right to this section here, the individual test section, and the Lyme immunoblot you want to get is test 325 and test 335. Okay, so 325 is the immunoblot IgM and 335 is the immunoblot IgG. So 325 is the IgM, 335 is the IgG. Okay. The reason I don't recommend doing their PCR test, PCR is a way of measuring genetic material. It will only find Lyme if you have it 30% of the time. The immunoblot will find it if you have it about 95% of the time, okay? And their immunoblot replaces their old Western blot, which they still have here. The Western blot also looks to see if you have antibodies that attach to Lyme proteins, but it does by only looking at whether you have antibodies against 2 strains, not the 8 strains. And in addition, they do not modify the protein, so you have a greater chance of false positive, okay? So I would just go right to the immunoblot. That's the best way to do it, okay? All right. All right. Thanks, John. Good luck to you. Hello, Jake. Hi, Dr. Ross. I must say that your detailed responses to so many different questions is quite impressive and very much appreciated. Thank you. I appreciate that. I don't get them all right, but most of the time I do. I give you enough information to work with. So good. Thanks. Yeah, I noticed that on your website, you sell at least 4 different biocide products. What do you normally recommend biocide for? Is this product primarily used to treat yeast, or is it for biofilms or something else? Can you explain the differences between each of the biocide products that you sell? Thanks for doing another incredible webinar. All right, so there's 3 primary biocide products. Wow, there's a number of them, but let me describe the 3 that I primarily use, and then I'll show you the other ones. So there's biocide, everyone is a supplement that's produced by a company called Biocide Botanicals. They used to be called Biobotanical Research, and then earlier last year, they renamed themselves as Biobotanical or Biocide and Botanicals is what they call themselves now. Right, so Biocidin is a mix of about 10 different herbs that have a number of properties. They can kill parasites, they can kill yeast, they can kill Lyme, including Lyme cyst and Lyme spirochetes, and they can remove biofilms, and they can help with something known as intestinal bacteria or small intestine bacteria overgrowth, okay? All right. So the reasons that you could use a biocide include treat Lyme, remove biofilms from Lyme. You could use it to treat small intestinal bacterial overgrowth. You could use it to treat intestinal yeast. So those are the primary reasons that you might wind up using it. Okay. Now, there is a product called biocide and LSF, and that is their liposomal variety. And the biocide and LSF is mixed in with fat to increase its absorption into your bloodstream. If you're going to use biocidin to treat Lyme, I would do the biocide and LSF because it gets absorbed into your bloodstream and goes where Lyme is, okay? The other two major varieties for treating these infections that I just mentioned are biocidin drops and biocidin capsules. Those are just a matter of preference. Do you like your things as a tincture or do you like it as a pill? Because they're not liposomal, they tend to stay in the intestines. You'll get small amounts absorbed to deal with Lyme, but they're better for intestinal problems like SIBO and like yeast overgrowth or biofilms within the intestines or parasite infections within the intestines, okay? So I'm going to use the drops or the pills when I have more of an intestinal problem. I'm going to tend to use the biocide and LSF when I have more of a Lyme problem, and I want to remove biofilms from Lyme problem as well too, okay? All right, then in addition, biocide and botanicals has a toothpaste that, may do some germ balancing in the mouth. They have a throat spray that could potentially kill viruses, bacteria, and yeast in the back of your throat. Let's see what else they have here. Okay, so I'm at my story again. So look under the group called Biobotanical. I got to change my name here, actually. So they're now called Biocide and Botanicals, and I just realized I need to update myself here too. But anyhow, so again, they have the biocidin capsules, they have the biocidin drops, they have the biocidin LSF, they have biocidin throat spray, and this again would be for those like throat infections you get. They have dentalcidin, which is a mouthwash. They have a toothpaste, and those would be their main products. Okay, all right. So anyhow, I guess I need to come in here. I know they've updated their name to Biocide and Botanicals. It looks like I need to change my page so it says that as well too. Anyhow. Oh, one other thing. If you're looking for an article I've written about their products, take a look at, just type in biocidin up here. And in here, I talk about what this is. I list out their ingredients, and I talk about what it may do. And then down here, I describe the main reasons I would use it, which include basically it can treat Lyme, it can treat imbalance of bacteria due to yeast, SIBO, or parasites in the intestines. I sometimes will use it actually to prevent recurrence or relapse of Lyme at the end of a treatment too. Okay. All right. And then down here, I describe the various ways you would take it. Thanks for the question, Jake. Hello, Colleen. Let's see. Is eating beans okay when treating candida? Initially, I was eating 0 fruit and 0 beans. I was taking 1 Mariva 3 times a day. After a Herx, I began taking 2 Mariva 3 times a day for a few months, and things leveled out. During treatment, I completely lost all cravings and my symptoms simmered down. I went back to my usual 1 Mariva 3 times a day and added in about a cup or so of berries 3 times a day. Aside from an egg a day, I eat plant-based food, so I also added about 1/4 cup beans per day for a bit of protein. Was this a bad idea? I can't tell which of these things, if any, triggered it, but I'm suddenly having tremendous cravings for carbs again. Also, is there a test to see if your good gut bacteria are present, or populated enough? Is it possible to take too many probiotics and overpopulate the good bacteria? Thanks so much for your guidance. So if you want to get an idea of I don't think you're going to hurt yourself by getting too many probiotics. Okay, just to answer that part of the question. If you want to get an idea of what a good makeup of your intestines is, you could do a test called a GI map. Which is a company has a test called the GI map. Genova Diagnostics has their own GI profile that you can do. So various companies make these GI profiles so you can get a sense of what the bacteria are and balance of organisms are within your intestinal tract, okay? In terms of, is 1/4 cup of beans bad? Depends on the person. Some people, it is going to be too much if they have active yeast. Some people, they can tolerate it just fine. If the only thing you changed was adding in a 1/4 cup of beans, then it might be that is too much for you and where you are with yeast at this point, okay? All right. Thanks for our question, Cully. Hello, John. Let's see. Can you get Lyme, Bartonella from dental donor bone grafts? About 10 years ago, I had a dental implant that required donor bone to be added since I didn't have enough. I doubt it was tested prior to these tick infections. Is it possible to acquire these infections via donor bone? I honestly don't know. I haven't seen anyone do studies to say it can be. We know that Lyme, if it's in the blood and so in the extreme case, we know that in a mother and a baby where their blood mixes together in the placenta, that you can have transmission of Lyme from mother to baby. So mixing of blood that has Lyme can result in transmission. It is possible in theory, if that bone graft had some remaining blood cells in it, that maybe Lyme could get through with those blood cells, but I would bet they did a lot to sterilize that bone before they put it in you. I don't know enough about what their process is, but I would be doubtful that this is a way to get it, but I'd have to look into it a lot more. Okay. All right. Thanks for your question, John. Hello, Jim. Hi, Dr. Ross. Thanks for these great webinars. I'm having a problem with mucus building up in the throat, which makes it hard to swallow. One of the few things that helps are antihistamines. The first generations ones seem to work. Is it okay to take antihistamines on a daily basis? If I do take them on a daily basis, would it be a good idea to rotate a few different ones? The thing about first generation antihistamines, everyone, would be Benadryl, okay, also known as diphenhydramine. Second generation would be the non-sedating antihistamines, which would be Zyrtec, Claritin, Allegra. In Canada, there's a few other names that they have for them too, but the second generations tend to be less sedating, but they often tend not work as well as the first generation, okay? So the only concern I would have if you're using Benadryl daily and you have a fatiguing illness is it adding to your fatigue? And only you can know that. If you stop the Benadryl and you have more energy, then you know that maybe it's adding to your fatigue, okay? But beyond that, I don't think you necessarily need to rotate them, and I don't think you need to change. I haven't seen anyone that has lost effectiveness of using antihistamines when they work because of the length that they were using them, okay? All right. And then the other thing you might consider if you are wanting an alternative way to decrease histamine-related mucus, because it could be that you've got just some low-grade allergies that is leading to mucus production, and then it drips from the back of your nose down into your throat, okay? So one thing you could do is to use a mast cell stabilizer. Mast cells are the cells that histamines are made in, and you can stabilize those mast cells so they don't make and release histamines as easily. And a good mast cell stabilizer is something called quercetin. It's a bioflavonoid product, and it comes in a 250 milligram pill. If you're using it more for allergy and allergy-related mucus drip, mucus accumulation, usually I advise people to take about 500 milligrams twice a day. And once they're stable, try to decrease it down to 250 milligrams 2 times a day. So half the dose. Okay. All right. All right. Good luck to you, Joe. Oh, quercetin is spelled Quercetin. And the product that I like using for it is a product made by Thorne called quercetin phytosome. It's this product right here. Okay. All right. All right. Thanks for your question. Hello, Pat. Let's see, Dr. Ross. If someone eats sauerkraut for its probiotics, does it need to be raw, unpasteurized? I'm taking an HMF Forte pill each day, but wanted to add in some probiotic foods as well. Thank you for these webinars. I would be concerned if it's pasteurized that would decrease the good bacteria, the probiotics, basically. So I would tend to go unpasteurized with this, okay? All right. Thanks for that question, Pat. Hello, Lisa. Let's see. My 50-year-old is long-haul pandas patient. He has Bartonella and can't take antibiotics or he gets C. diff. What is not an effective non-antibiotic treatment for Bart? All right. So first of all, let's talk about C. diff. So C. diff, everyone, is also known as C. difficile. It is a bacteria that normally lives in our intestines. Everyone has it living there. But the trouble is when people are on some people, when they're on antibiotics, it leads to C. diff growing too much. And if it grows too much, it releases toxins that lead to bad diarrhea, basically. Okay. There is a probiotic known as Saccharomyces boulardii, or called Sacro B for short. So SACRO, and then the letter B, Sacro B for short. That Saccharomyces boulardii has been used to help treat C. difficile. I don't think it would work by itself, but it can help when you're on antibiotics to treat the C. difficile. The other thing you can do, it can help prevent C. difficile. All right. So if you are, when I advise my patients that develop C. difficile during treatment, whether it's from prescription or herbal antibiotics, although to be honest, I don't think I've ever had anyone develop on herbal antibiotics, but even if they develop it once on prescription antibiotics, even if I go to herbal antibiotics, I'm going to want them to also take Saccharomyces boulardii capsules. And you would do, Thorne makes a product called Sacro B, and you would wind up taking 2 pills 1 time a day. And yeah, in a 15-year-old, that's the dose I would use there too. Okay. So part of your prevention regimen, rats, you would need to talk with your panda specialist. Sometimes typical probiotic, bacterial probiotics can sometimes lead to worsening of PANS and pandas, okay? But this is not a typical probiotic. This is a healthy yeast in the intestines. And I would, before starting it, check in with your pandas provider and see how they feel about you using Saccharomyces boulardii or Sacro B, okay? Regular probiotics like human bacteria strains in probiotics can sometimes make PANS and pandas worse. I'm not clear off the top of my head whether that happens with Saccharomyces boulardii. So check with your provider before you try to do that, okay? All right. But for those of you that are listening in that don't have PANS and pandas and get C. difficile, realize that's part of your prevention regimen in the future. Be on Sacro B, 2 pills 1 time a day, okay? All right. Then, in terms of in my opinion, I haven't seen anyone that had C. difficile that it came back when they did herbal antibiotics, okay? And the herbal antibiotics that I would be inclined to try for Bartonella are Hutania, Sida acuta, and cinnamon clove oregano capsules, okay? That would be my herbal approach. It is something you could give a try here, but again, talk this over with your healthcare provider as well too. Okay. All right. me show you an article where I describe how to use the Psittacuta, Houttenia, and the cinnamon clove oregano. All right, now the cinnamon clove oregano I'm including because that treats Bartonella can live in a growing state and a hibernating or persister state, and the cinnamon clove oregano deals with the persisters, helps with the growing, but it deals with the persisters. Okay, all right. So we're going to look at my article called "Kills Bartonella," a brief guide. That's right here. And if you scroll down to what I call Tier 2 treatments, oops, what's going on there? So Tier 2 Bartonella treatments is Houttenia plus Psittacuta plus cinnamon clove oregano oil combo. Okay, so just read this section here. It's where I describe what you can do. Okay, all right. Good luck with your son, Lisa. Hello, Mary. Let's see. Could you please discuss brain scans, risk versus benefits, and how one is obtained? So I would need to know more what you mean by a brain scan. So there's CAT scans, there's MRIs, there's PET scans, there's a variety of different things. All of them, though, are ones that would require a prescription from a physician or an order from a physician to do it. I guess I would need to know a little bit more why you're asking this or what you're looking for. So I'm not going to be able to give you a full answer right now. Okay? All right. Well, let me talk about 3 scans. So the MRI, CAT scans, and PET scans, okay? PET scans, and I don't think that any of these are risky for somebody that has Lyme. In a PET scan, and I don't know what the actual material is they give you in a PET scan, but they give you a material that will light up in areas of the brain where there's a lot of good blood flow. And in Lyme often, and in Bartonella often, areas of the brain start getting less blood flow and they don't light up as much. All right. So that's what you can learn from a PET scan is do you have areas of the brain that aren't getting adequate blood flow? The other type of X-ray you can do is an MRI, and an MRI uses measures electron action in your cells, and it uses a big magnet to see what's going on with the electron action. And sometimes they'll give you a dye called gadolinium that makes it so that your blood vessels can be more easily seen. That one, I don't, for limited use, should not have any toxic effect on that one. It is a good test to look at your architecture of the brain with great detail, okay? All right. The old way that we used to look at the architecture of the brain, not blood flow, but the architecture of the brain, was a CAT scan, which uses older radiology technology. And it is probably better more in an acute situation. MRIs take a time, but CAT scans can be done fast. And CAT scans can give you an idea whether you got a bleed around the brain or not. Okay, that's what we tend to use those for these days. Okay, all right. Thanks for your question, Mary. Hello, Heather. Let's see. I have Lyme, Bartonella, and tularemia. I've been having severe and worsening neck pain. The scalene muscles in my neck are so tense that they elevate my first rib, which is very painful. The only relief I found is massage and my physical therapist manually putting my rib back in place. Do you have any idea which pathogen could cause this, which makes it more complicated, as I also have Ehlers-Danlos syndrome? Thank you. All right. So Ehlers-Danlos syndrome, everyone, basically results in some laxness or stretchiness of the joint capsule. So joints are harder to stay in place, which could be why you're having an easy time of that rib popping out. In terms of which germs could lead to this more than the other, they all have probably equal chances here, to be honest with you. One thing you might want to consider, in addition to what you're doing, acupuncture sometimes can be helpful for something like this, okay? All right. Good luck to you, Heather. Hello, Simone. Let's see. Hi, Dr. Ross. What is the treatment? Oh, I think I answered that earlier. Hello, TJ. Why is seborrheic dermatitis on the face? What is your theory on the reason? Is it the lymph byways or hair follicles just seem odd where it shows up, but also where it doesn't? Okay. So seborrheic dermatitis, everyone, is found on the head. And when we find it up here, we call it dandruff. That's that white flakiness you'll see in some people, okay? It also can occur along the ears back in here, can be in the ears in these areas, can be along in here, down in these areas here, sometimes men in the beard area, sometimes up around the eyebrow. And what you get, what it looks like, is a lot of redness and flakiness of the skin. Okay. There are a number of theories about what it is, but the truth is we don't really know what it is. We just don't know. And therefore, it's hard to say why it occurs on the face. I don't know what it is. I mean, I sometimes think it's some type of an allergic reaction. Well, I postulate it's some type of an allergic reaction we're probably having to normal organisms that live in these areas. So a little, our skin is covered with bacteria and fungus. There's stuff that lives on our skin. And I wonder if we have reactivity in some people in those areas. Why it would be in here, I don't know. The treatments that we use for it, you can use dandruff shampoos where you lather up the dandruff shampoo and you leave it on there while you're showering. That sometimes keeps it under control. Sometimes steroid creams will keep it under control. Sometimes anti-yeast medications like cotrimazole and ketoconazole will keep it under control. Also, if you tend to get some dysbiosis of your gut where you have imbalance of good bacteria and you get too many yeast, that sometimes leads to more triggering of this up here. So you want to make sure you're doing a good job with your probiotics. And if you got too many yeast, knock them down in your intestines, balance out the good bacteria down there. Okay. But as to what it actually is, we don't know. After all these years of medicine, we don't have a full idea on it. Okay. Thanks for that question, TJ. Hello, Sandra. Hi, Dr. Ross. Thanks so much for everything. You're welcome. 2 quick questions. I have had Lyme on and off, or Lyme and on and off antibiotics for quite some time. I'm now on only 250 milligrams of amoxicillin daily and herxing every day for 3 weeks. Is this typical? Should I pulse? Also, doctor recommended Hootenea for Bartonella symptoms. Can I take this with amoxicillin? So you can take the Hootenea herb along with amoxicillin at the same time. Amoxicillin is not going to do anything for Bartonella, though. It's going to be primarily for the Lyme infection. And the Hootenea is probably not going to do anything for the Lyme infection. It's just for Bartonella. Okay. In terms of herxing for 3 weeks, that's starting to get to be a little long. And I would wonder if there's something else that's stirring up your cytokines. If you were my patient, I would probably be spending a lot of time asking and seeing if you got too many yeast growing in the intestines. That's just triggering too many cytokines to be active in you, okay? You could look at my article I showed earlier about how do you diagnose yeast, okay? All right. Good luck to you. Hello, Sharon. Let's see. I noticed that the peptides are pretty expensive, and I'm wondering how long they should be taken. Maybe your book has all that information. I'm going to buy it. Thank you. Well, thanks for buying the book. I can tell you that piece of information. But yeah, in the book, one of the things I forgot to mention earlier, there's a whole section I have in the book about key information, like how do you manage cytokines, low-dose naltrexone, peptide therapies is in there. So key information about supportive things you need to do to manage your Lyme care. And also in the book is my Ross Lyme support protocol as well too. So generally, what I recommend people do is a 2 to 3 month trial of a peptide to see if it's going to make a difference. If you haven't had benefit by 2 to 3 months, then I have people stop. And yeah, they are expensive, unfortunately. Yeah. All right. Thanks for that question, Sharon. Actually, hold on a minute. I got to make a note to myself here. All right. Hello, Mary. Hi, Dr. Ross. Thanks again for answering my question. How can you tell if an irregular heartbeat and fluttering of the heart is a Bartonella or Lyme herx or side effect from clarithromycin? Does a combination of clarithromycin and rocephin work well for chronic Lyme? Thank you. So clarithromycin does, and some people can trigger palpitations or skipping around of the heart. And the only way to know is try it. If it gets worse, if it starts happening with clarithromycin, probably from the clarithromycin, okay? And then stop it and see if it goes away. At least that's what I do with my patients. Talk to your own provider before trying this, though, okay? And then in terms of clarithromycin, and then in terms, let's see. So I wouldn't think of fluttering and skipping of the heart being part of a herx. It could be triggered by clarithromycin. And then both Lyme, mainly Lyme, not Bartonella, can sometimes trigger some arrhythmias or abnormal beating of the heart, okay? So those would be my comments there. There's no way to really tell which one it is, whether it is, well, actually, it's pretty simple. So in terms of figuring out if your fluttering is a side effect, stop the clarithromycin and see if it goes away. But do that only after talking to your provider, okay? And then in terms of Lyme and Bartonella, as I said, Lyme would be the one that would give you some of the skipping around. And then, yeah, anyhow, those would be my comments I could give you there. In terms of rocephin and clarithromycin, they do two different things. So clarithromycin for Lyme treats the spirochete Lyme by limiting its growth and blocks protein production inside of the spirochete. The other thing it does is it gets inside of cells where intracellular Lyme lives, and it blocks protein production of intracellular Lyme. So that's how it eventually results in death of that germ, okay? The rocephin, also known as ceftriaxone, is an antibiotic that works on the outside of the spirochete and does not get intracellularly, all right? So it's only useful for spirochete Lyme. And what it does specifically is it limits the ability of the spirochete to repair its covering, its covering when it gets damaged. And eventually it just gets so many injuries to its covering that it bursts as it grows, basically, okay? So they do two different things. You can use them together, okay? Excuse me, everyone. Excuse me there. Hello, Ken. Let's see. You are truly a caring individual. Share your wealth of knowledge with the Lyme community. Thank you. Thank you for saying so. I appreciate that too. My question is, how long should antibiotic therapy continue after you see signs of improvement? So my general rule of thumb is to use antibiotics, prescription or herbal antibiotics, in somebody that has tick-borne illnesses until one of two conditions is met. One, they're completely well for at least 2 months. And I use them even during those 2 months that they're completely well. And I'm doing that to make sure I knock out every remaining germ and prevent relapse from happening. Okay. And I find it's more useful to treat for at least 2 months to prevent that. The second thing I'll do is, with some people with Lyme and tick-borne infections, we're not able to get them 100% well. Part of that problem may be from germ injury from having had the infections. Okay. So the other rule of thumb I have is to treat using antibiotics until somebody is in a good plateau, maybe not 100%, but they got somewhat better for at least 4 months. And no matter what I do to try to get that treatment to move further forward ahead, I can't. And that goes on for at least 4 months. Then I'll consider stopping that too. Okay. All right. Thanks for that question, Ken. And thanks for your comment. I appreciate that. Hello, Lee. Let's see. Hi, Dr. Marty, from a fellow Basenji fancier. Now, many of you know I bring my 2 dogs to work with me. I'll grab one of them to show you here so you can see what a Basenji is. Come here, Eno. Come on. Ooh, oh, my goodness. All right. This, everyone, is an old Basenji. This is Halo. She's 15 years old. Her brother's name is Thor, and he's 14 years old. Okay, so they both come to work with me, and they usually are more of they have a red fur. The majority are more red color instead of being the black like that. They can also be tricolored, black, white, and tan, or they can be a brindle where it's all mixed together. But anyhow, that's a Basenji. So I appreciate that, Lee. we're not a bunch that would choose to own a Basenji, so I appreciate that. My question is, I had a jaw cavitation surgery done in December from an old wisdom tooth that had been removed. Tissue sample taken from the cavitation sent to lab DNA connections. What does it mean when that test comes back? NPS for Borrelia burgdorferi, BC, NPS Bartonella, NPS Borrelia, Babesia decani detected. Do I have Lyme disease? So I don't trust that lab. That's what I'm going to say. I don't know what it means. I don't know what it means when it comes back saying you have those germs, and I'm not even sure what their NPS terminology means as to whether they're saying you do or don't have it. But even if their testing said you had it, they haven't done sufficient validation to show that their technique is adequate. All right. So any lab that is not an FDA approved lab should go through a process where they take samples and they test samples from somebody known to have certain conditions and people known not to have it. So in the case of Lyme, they take blood, for instance, from somebody that has a Lyme and known to have Lyme, and they take blood from people known not to have Lyme, and they do their tests and they see how accurate are they predicting who has it and who doesn't have it. Okay, that's called validation studies. And DNA Connections has never done human validation studies where they take samples from humans known to have the illness and see how good is their test technique. They've never done it. I used to get people coming in with DNA Connections testing years ago, and they would come in saying they have Bartonella and Babesia, and yet they would have no symptoms of those illnesses. So one day I called up DNA Connections and I said, tell me about your validation studies, and they didn't have them. Now, they will tell you that they've done validation to see if their probes are active, because their DNA probes are active, but their DNA probes being active doesn't mean that they accurately detect in living human beings, okay? And so I don't know what it means, unfortunately. I would be asking your provider why they even bother using a lab that hasn't validated itself, but that might be a little bit political to do too. But yeah, I don't know why providers are using DNA Connections, to be honest with you. Okay. All right. Thanks for that question. Hello, Nancy. Let's see. Hello, Dr. Ross. In July, I tested positive for Lyme and Babesia. B. microti IFA was 640 for my Igenics labs. Also, I tested positive for mold trichosithine group, and my adrenals are shot. I did a round of doxy and started Mepron, stopped the Mepron because of Herx reaction, switched to Desbio, VOBA1M. I'm now in my second series, and the Herx reaction is much worse. Sliming headaches in front of the skull, tingling nerves, firing all over my body, leg cramps, no short-term memory, can't concentrate, anxiety, panic attacks, so bad I can't drive. It seems to drive by PTSD. My naturopath wants me to hit it harder with trying minocycline and Mepron again. I have had most of these symptoms for years, but they have been greatly magnified by the Lyme and Babesia. So I'm assuming the mold toxins have been there for a while. What are your thoughts, and what do you think of ozone treatments, UVBI treatments, and sauna blankets, and would GCMAF play a role here? Okay, so a lot of stuff here. So first of all, I just want to make a comment. If you're herxing, and it sounds like you may be, again, I don't get to ask you a bunch of clarifying questions here, okay, but just what you wrote sounds like herxing. I would strongly urge you to do things to control cytokines. So I described cytokines earlier tonight, but basically whenever you have an infection in you, the immune system reacts by making cytokines. Cytokines are good. They turn the immune system on. But if the immune system is having a hard time dealing with something, it's going to make too many cytokines. Too many cytokines make you hurt all over, give you neurologic symptoms, give you psychiatric symptoms, give you fatigue, give you brain fog, make it so your adrenals don't work and cause you not to sleep. Okay. All right. Now, if you start killing germs, the immune system is going to see all those dead bug parts, and it's going to make more cytokines. Okay. So a Herx reaction is a cytokine surge. Two fundamental things that I have my patients do to control cytokines. Number one, be on curcumin. I like using a liposomal variety. I use a product by Thorne that does that called curcumin phytosome, 500 milligrams 3 times a day. And if that's not decreasing the amount of herxing a person's have, I'll go up to 1,000 milligrams 3 times a day. Second thing I like to do is liposomal glutathione. By liposomal, I mean it's glutathione that's microscopically wrapped in fat. The microscopic fat helps increase absorption of the glutathione, okay? And it's a strong antioxidant. The way it helps with herxing is it lowers oxidation signals that tell your white blood cells to make cytokines. The other thing is it helps remove toxins from your body through the liver that trigger cytokines as well too. And I'd have a person do 400 to 500 milligrams of that twice a day when they're really herxing. The product I like for that is a product made by Research Nutritionals called Tri-Fortify, either an orange or watermelon flavor, okay? So I would make sure you're on those. I mean, if you were my patient, that's what I would do. I would make sure you're on those, okay? Now, in terms of ozone and UVBI, these are what are known as oxidation treatments. They either give you ozone rectally or through an IV, or you inhale it. UVBI, they draw blood out of you and they use an ultraviolet light to treat the blood and they put it back in you. But all of these create oxidation. And presumably, doctors think that oxidation kills germs. Well, guess what? It doesn't. And the reason, so I want to describe that, okay? The thing that it can do, though, oxidation is useful for getting your cell energy factories called mitochondria to work better. So you might get some increased energy at first. The long-term risk of doing these, though, is increased oxidation can damage your cells, okay? So doctors, I think a number of my colleagues falsely believe that oxidation, ozone, hydrogen peroxide, UVBI, UVBA, all that stuff, that it can kill germs. And the reason they do that is there are test tube experiments that show if you put a test tube and you put germs in it and then you drop ozone into it, all the germs die. Okay, that looks great, okay? But if you run the same experiment and you put microscopic amounts of blood in, then put the ozone in, guess what? No killing at all, right? And the reason is all those antioxidants, even in a minuscule amount of blood, all neutralize the killing effect of the oxidation caused by these treatments, okay? I do admit sometimes people feel better when they get these treatments, but I think it's because all of these treatments result in better oxygenation of your cell energy factories called mitochondria, and it helps them work better. Okay, all right. In terms of sauna blankets, I'm not sure what a sauna blanket is. And then in terms of GCMAF, so there's a type of cell called a macrophage activating, or macrophage. Macrophages help fight primarily viruses. And when we get chronic virus infections in us, those chronic viruses may or make in their covering an enzyme called nagalase. Nagalase basically breaks a sugar group off of a chemical called GCMAF, and that MAF of GCMAF stands for macrophage activating factor. So nagalase from viruses can make it so the activating chemical for macrophages called GCMAF is rendered useless by breaking a couple sugar groups off of them. Okay, all right. So some people that are not feeling well may have chronic virus infections, and we could give you GCMAF to replace what is being destroyed by the nagalase, and it may help. Okay. Now, it used to be a lot of us were getting our GCMAF from Europe, and the U.S. Food and Drug Administration basically banned our ability to do that. So I don't even know where you get this stuff anymore. About maybe 10 years ago, maybe 7 to 10 years ago, I used to use GCMAF in small amounts with my patients with some benefit, but I don't know where you get it. And then there were some bad outcomes that happened from it. A number of doctors were prosecuted for using the stuff, so I don't even know who you would find to use it these days, honestly. Okay. All right. Anyhow, I hope I answered most of your question there. Good luck to you, Nancy. Nancy, I'm going to just do a quick screen share here and show you one thing you may want to take a look at. All right. So in terms of, I have 2 articles that you may want to look at regarding cytokines and Herx reactions. Okay. Take a look at my Herxheimer and cytokines section here. And this is my overview article about cytokines. And then this is the one about how do you manage Herxheimer reactions. You're going to find some duplication in information between these, but together they kind of give you some input on the kind of things I was just talking with you about. Okay. All right, let's get it here. All right. So, yeah, I hope that answered your question. All right. Anyhow, everyone, it's currently 5:30 my time. So we've been with you here for about an hour and a half now. And I've got a couple of Basenjis to get out. I got to feed them and I got to feed myself. So anyhow, it's been good being with you here tonight. Again, look tomorrow morning, somewhere in the morning between around 9:30 a.m. Pacific Standard Time. You should get an email from me by that time announcing that the recording has been edited, ready for you to view. It'll also have a link to sign up for the next webinar, which will not be next week. It's going to be the week after next week, okay? I've enjoyed being with you here tonight. I hope you found some useful things that can help you. And I have one request of you. Tomorrow morning, when you get my email, forward it to other people that you think may get benefit as well, too, okay? Good night, everyone.